Like that's a big reason to consider like giving yourself time to get what I call baby body ready before you get pregnant. And they don't know why yet. Okay. So this study just came out and they're like, we don't know why. And then there's critics who are like, I can't believe you would even question the pill. This is women's rights. Yes, it is a woman's right.
Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby.
Hey everyone, I'm Sarah Clark, and my mission is to inspire, motivate, and empower you. And most of all, I want you to wake up. So with functional medicine, we can discover what causes infertility and eventually reverse the condition. Today, I'm welcoming Dr. Jolene Brighten to the podcast, and we're digging into post-birth control syndrome and how it impacts your fertility. So Dr. Jolene Brighten is a functional medicine naturopathic medical doctor and the founder of Rubis Health, a women's medical clinic that specializes in women's hormones. She's recognized as a leading expert in post-birth control syndrome and the long-term side effects associated with hormonal contraceptives. Dr. Brighten is the author of Beyond the Pill, a 30-day plan to support women on birth control, help them transition off, and eliminate symptoms of post-birth control syndrome. She's a speaker, women's health advocate, and a medical advisor for one of the first data-driven apps to offer women personalized birth control recommendations. Check out her website at drdrbrighten, BRIGHTEN.com. And before we jump into today's show, don't forget to hit the subscribe button on iTunes or wherever you're listening to this to make sure you never miss an episode. Hey everyone, we're getting super booked up for our functional testing and couples coaching program and have very limited spots available. So we ship our functional test kits worldwide, and we use food sensitivity testing using blood. We look at hormone testing using urine. We use the Dutch test. We look at stool testing, looking at the DNA of your stool. We also do hair tissue mineral analysis. All of these tests are included in our couples coaching program. So there's only 4 spots available for January and February. So if you're looking to have your baby in 2019, especially if you are struggling with low AMH, POF, POI, or low ovarian reserve, please click on the link in the show notes to book your free call. Talk soon. Hey, Dr. Brighten, welcome to the podcast. Excited to have you.
Hi there. Thanks so much for having me.
Yeah, awesome. So if you could share your story with us and how you came to do this work.
Oh yeah. So, my story is a bit of a long one, like most of ours, I think.
Yeah, exactly.
Yeah. And that, I was a kid who was really sick. I had a lot of digestive issues, and I ended up, it was a 10-year adventure with that, which eventually led doctors to say that my symptoms and everything that I was experiencing was all in my head, like so many of us women. And it's interesting because it really wasn't until I got into writing my book, Beyond the Pill, that I realized like, wow, like I've been told it's in my head, like since I was 7, like this has been a long time. And then, what actually happened is that, starting at 7, I had heartburn, gastritis, so inflammation of my stomach. I would throw up. By the time I was 10, I was throwing up after most meals. Oh, wow. And everybody was like, she has an eating disorder. She has this, she has that. But it's something psychological. And the reality is that they hadn't discovered H. pylori yet. And so once they made that discovery, it was when I was 17 that they were like, hey, you might have H. pylori. And I was tested for it, my second endoscopy, and lo and behold, I had H. pylori, and I went through treatment on that. And I tell that little bit of my journey because I think it's really important in the context of women's medicine. This was me as a child, but that we didn't know about H. pylori yet. We hadn't discovered this microorganism that lives in this stomach and could actually lead to ulcers. And instead, people were told that, these stomach problems were, part of their stress or psychological. And it was just because medicine didn't have the understanding yet. So, something I was told at 17 was that I would be on these proton pump inhibitors, these pharmaceuticals, for the rest of my life. That was going to be my journey. Never mind, they weren't tested in children yet at that time, or that I was 17 and I was like, I'm not going to take a pill every day. Except I started the pill. So I traded one pill for the other, and I actually started studying nutrition because I made the link between, hey, wait, I get heartburn if I eat a bunch of refined carbs and have like pasta sauce and then drink orange juice and have some sugar. And it's like, oh, okay, there's a link here. Even though my doctor told me there was no link between diet and any of my symptoms, like, that's also something a lot of us have been told. And I'm a bit of a rebel. So I went on to study nutrition. So my first degree is in chemistry because I'm also a big nerd. My next degree was in nutritional biochemistry. And I was actually going through my education. I was going to get my PhD in nutrition. And then I discovered naturopathic medicine. And after having so many years of science, I realized that if I wanted to help people really heal, I needed to also be trained in the philosophy that respects the body and that is relentless in asking why. And so that sent me to naturopathic school. I was like, I'm going to be a gut expert. That's what I want to do. Until I had the epiphany that most of women's medicine was done to them, not with them. And I felt like, that was my calling. I need to go into women's medicine. I spent 2 years doing a women's health rotation and also working in a homeless youth shelter where I dispensed and prescribed a lot of birth control. And, at that time I was going through, so I was entering my second year of medical school that I decided to stop the pill. I'd been on it for 10 years. I learned in class that women are fertile one day out of the month. And I was like, hey, wait, hold on. What? Like, how is it that here I am in my late 20s, just learning how my body works, how my menstrual cycle works. And nobody mentioned to me that you're taking a pill every single day to not get pregnant. Yet there's a week max that you could get pregnant. And there's actually ways to understand if you can get pregnant. And the sad reality is, and I'm sure a lot of your listeners this will resonate with them as well, is that most of us are not so it's not any education whatsoever is given to us about how our body works and when we can get pregnant until we set out to get pregnant. And I've actually had so many patients say to me, if I knew how finite that window is, how difficult it is to get pregnant in a month, I don't know that I would have ever used hormonal contraceptives because it's actually harder to get pregnant than I thought. And that's, that goes back to sex ed being this epic fail where they're like, if a guy looks at you, you're going to get pregnant. And it's we don't need to be scaring young women. They're really smart. Okay. You could educate her. It would go a lot further. So yeah. And, I have to share that so I developed post-birth control syndrome. I thought I was a freak. I thought something was wrong with me. I felt really ashamed. I didn't even want to talk about it. I came off for the first time in my life, I lost my period. Now, mind you, I had had the worst periods for 3 years of my life, dreading them. I'm talking hot water bottle hugging, Midol popping, vomiting inducing periods that lasted 8 days or more. And you better believe I marked off my calendar as if doomsday was coming every single month. But when I came off the pill and I lost my period and I developed cystic acne, my doctor actually said to me, you have PCOS and you've likely had PCOS your whole life and that's what's going on. And I was like, wait a minute, no, because I always had regular periods. That doesn't make sense. And he actually said, you probably just don't remember. You just don't actually know what your periods were like. And that is such a disempowering thing to say to someone. But I'm like, no, I dreaded that. I dreaded that period. I know my periods were regular. I know. And, but, I felt really ashamed through all of that. And so, having a background in nutritional biochemistry, being in naturopathic medical school, learning about herbs, learning about supplements, how to leverage nutrients. I had this whole background on how to use food as medicine. I actually was able to restore my period, eliminate my cystic acne, get rid of my wild mood swings. When my period came back, it came back with a vengeance, and I was able to fix that as well. And it was something where, it's only now that I look back that I'm like, I had what so many of my patients have, which is post-birth control syndrome, and there's solutions to that. I share the bit about the homeless youth clinic because after I came out of that, I was like, I don't want to talk about birth control ever again. But something that struck me as interesting is that was a state-run program, which meant that we had to give a full informed consent when we prescribed birth control. Yet I was doing rotations in internal medicine and primary care offices, and these were with medical doctors. I'm no way, dissing medical doctors, but what I'll say is that it was like, you're going to college, here's the birth control pill. No talk about stroke, no talk about heart attack, no talk about any impact on your health whatsoever, or a question of, are you sexually active? It was just like, here you go. You're going to college. And that was something that really struck me as odd. Like, why is there no discussion happening here? Why are we not telling these young girls anything about birth control? And, so much of that experience is why I'm not anti-birth control. It's because, these women who were coming to the homeless youth clinic, they are a very at-risk population. They live on the street. They can't protect themselves, and they're at higher risk of being sexually assaulted, and they cannot get pregnant. And for them, using something like the Depo-Provera shot was like the best thing that they could do to protect and safeguard their health, being in a vulnerable situation. And so I say that bit because, I think it's really easy. People want to make everything black and white. And people are very quick to be like, Dr. Brighten, she's the lady who's anti-pill. And I'm like, no, no. I'm just like, can we all just get in the know about it? Decide what's best for us and feel confident in that decision and have our stories believed if we do have side effects, and be supported through all of that. So that's a bit of, my story. I know it's a long-winded one, but really it was through my clinical practice that I came to realize I wasn't a freak, that a lot, if not all, women struggle in some way to come off of hormonal birth control, whether it's initially or it's 12 months later and they don't make the connection to that. And I got the reputation as being the doctor who believed women's stories around hormonal birth control. And so before I knew it, I had a whole practice full of women who were having birth control related side effects or post-birth control syndrome. And my husband to this day laughs, and he's like, remember when you were like, I never want to talk about birth control again? And like, now I wrote a book on it.
Yeah, it just kind of comes to you, right? So it's interesting and thanks for sharing your story, because as you say, it's not unlike many other women that are experiencing the same thing as you, and then being dismissed and thinking it was in their head, and then years and years of struggle, and then wait a minute, this is kind of what the issue is, and you being fortunate enough being able to discover this and then being able to heal it naturally. Mm-hmm. Yeah, so let's kind of figure out, so let's talk about, how does the birth control pill impact our fertility?
Yeah, so this is something like this is what I call like the ostrich maneuver, where I feel like medicine is sticking their head in the sand and just pretending like nothing happens. Just so you know, sometimes I think I'm funny, but for real, like, we do not have enough research around hormonal contraceptives and their impact on women's body. Like that, I want to say straight out the gate. And so our understanding is just, we just don't have the depth of understanding to truly give the woman a full story, especially when it comes to her fertility, because the narrative goes, and this is like, medicine, everybody can do this, but medicine has this way of adopting dogma and then just running that story over and over, despite like women having stories that contradict that. And so one of those stories is that it has no impact on your fertility, and that in fact, you can just get off the pill and become pregnant right away. And I'm going to explain why you shouldn't do that, because you should not do that. But with that, it's something that, like, we all have that girlfriend who got pregnant on the pill, or, that got pregnant, as soon as she came off. And so, yes, that's true for some women, but it's not true for all women. And the way that the hormonal birth control pill, and really all of these hormonal contraceptives are used these days, the number one reason women are put on them, and their stated reason for taking them, is for non-pregnancy prevention reasons. So we're talking about things like acne, irregular periods, heavy periods, painful periods, things that have a root cause. Now, why does this matter? Because a girl can be past the pill at 14 years old so that she can have a regular period induced. By the way, that's not a period. That is a pharmaceutical withdrawal bleed. So your doctor might be a little bit confused about that. I want you not to be confused about that. You're not ovulating, because that's how the pill works. It should shut down your ovulation. And so with that, that's a chemically induced bleed. However, at 14, maybe you have PCOS. Maybe you have hypothyroidism going on. Maybe you're having heavy periods and it's actually endometriosis. Like there can be a root cause to these symptoms that are, quote unquote, period problems, that the doctor will pass you a pill without any question of why. And this is really, what like Beyond the Pill and my work is about, is like, if you want to do the pill, that's totally your choice. Let's keep you safe. Let's give you the full story. But at the same time, we best ask why before you pop that pill. Because if you're masking hypothyroidism, you could be in big trouble 20 years later from not having ample thyroid medication, or you could be losing your hair. But these underlying issues, yeah, right. I developed postpartum thyroiditis after having my son, which is an autoimmune condition. It's Hashimoto's, but they call it postpartum thyroiditis if you just had a baby. With that, that's another way, another time in my life where doctors are like, "You're a mom, you're just stressed out, you need to sleep more." And then 18 months later, they're like, "Oh, snap, you're hypothyroid." I'm like, "Yeah, you think? I don't even fit in my 3rd trimester pregnancy clothes because I've gained so much weight." And they were like, "You need to eat right and exercise." And I'm like, "I can't even move. I'm so tired." Like, what are you talking about? So back to the fertility piece. So one is, if your doctor passed you the pill or any other form of hormonal birth control to basically mask those symptoms, and it does that pretty well, then there might be this underlying issue that's left to brew. So PCOS, polycystic ovarian syndrome, extremely common. That's one thing that women will be given hormonal birth control, no discussion. And we know that it's a big reason women are experiencing infertility. So then you come off of hormonal birth control and you're unable to get pregnant. And when do women come off of hormonal birth control? When they want to get pregnant. And that tends to be these days in their mid-30s. And so then their doctor's like, "Oh, yep, you got PCOS, you're infertile. Oh, yep, you're 35, you're old. That's too old to have a baby." And it's like, no, wait, hold on. Like, firstly, don't you ever say that. Like, don't say that. But the other thing is that, the pill never addressed the root cause. And the root cause of polycystic ovarian syndrome is metabolic issues. That's why there is an entire chapter Beyond the Pill called Metabolic Mayhem, and it is addressing this PCOS issue for women, and with the understanding that blood sugar dysregulation, insulin resistance, inflammation, any of those things can lead to fertility issues, and those are present in PCOS women. And they get worse when you're on hormonal birth control. So the pill can actually induce blood sugar dysregulation, insulin resistance, and we know it's inflammatory. Now, the other piece to it impacting your fertility, and where, like, I started this of saying, like, we need a lot more research, is there have been studies showing that being on the pill contributes to a downregulation of hormone receptors in your endometrial lining. So if you don't want to get endometrial cancer, we believe this is the hypothesis, and this is why the pill lowers the risk of endometrial cancer, is because you don't have the receptors, you're not stimulating that endometrial tissue in the same way. Endometrial tissue is the lining of your uterus. Now, the trouble is that when you come off, those receptors don't necessarily upregulate again. And it's been reproductive endocrinologists who have observed that women who have spent about 10 years or more, so like me, on hormonal birth control, they have thinner uterine lining. Now, this is extremely heartbreaking because you can get pregnant, but you cannot maintain that pregnancy. Right. So a sperm can meet egg. If you have a fertilized egg, but the way I like to explain it to women, and you'll read this in Beyond the Pill, is it's like your uterine lining. Think of it like, okay, is it a hard floor to lay in, or is it a big, soft, comfy down comforter? Like, which do you want to nestle up in? You want to nestle up in that down comforter. And so there's a certain thickness of the endometrial lining that makes that fertilized egg want to nestle up into the uterus and stay put. Whereas if it's too thin, it's like you're laying on the floor. You're never going to get comfy there. And then that can result in a miscarriage. Why did I say just because you can get pregnant, you shouldn't get pregnant when you come off of birth control? So here's the thing. Hormonal birth control depletes nutrients like crazy. So like selenium, magnesium, B vitamins. Like this is something that like is really, really troubling to me. And I actually learned about this when I was getting my nutritional biochemistry degree. So it has been well understood forever, like since the 70s, that like the pill is going to deplete your vitamins. And so when you're, I'm studying nutritional biochemistry at the same time I was taking the clinical nutrition track as well, which is to become a registered dietitian. Obviously I didn't go that route, but with that, we were taught if a woman is on the pill, then she definitely has to replenish folate, but she should be on a prenatal or a multivitamin. And there have been studies that say that every woman who's in their reproductive years should really be on a prenatal vitamin. especially if she's on hormonal birth control. Now, what's troubling to me is you could be on the pill. It's only about 91% effective with typical use. So not the 99% we're told, because we're not perfect. That's perfect use. I'm not perfect. I don't know about you. But with that, you could be on the pill depleting folate, you become pregnant, and you need folate like 2 weeks before you get that positive pregnancy test. Like the minute you are pregnant, you need folate. And yet you're on a medication that's depleting that, not to mention B12 as well. So we want to replenish those nutrient stores before getting pregnant. That's definite. Because so pregnancy is highly nutrient demanding for sure, but breastfeeding even more so. And there are some experts that hypothesize why we're seeing the climb in postpartum depression. It's because our food supply is so nutrient depleted. Women are entering into pregnancy more nutrient depleted than ever. So there's the nutrient bit. There's the bit that like hormonal birth control messes with your microbiome. It decreases microbial diversity. Your gut bugs become baby's gut bugs, become baby's immune system for life. So you've got to rebuild that before you become pregnant. Hormonal birth control is incredibly inflammatory. So they've done studies that it increases your C-reactive protein. So your C-reactive protein may be up. If you are inflamed, you may very well, so if there's inflammation, that can lead to infertility as well. So if you come off and you want to get pregnant right away, that might not be possible. And it's worth noting that there are studies that have shown that like it can take a good 18 months for a woman to become pregnant after coming off the pill. And this is important to frame it in that the average couple with nothing going on will take about 6 months to get pregnant. But a woman who's used hormonal birth control could take 1.5 years, maybe 2 years to become pregnant. And that's important to know because if you're 38 and you are thinking like, oh, or, let's say like you're 35 and you're like, I want to be pregnant at 38. I'll just come off at 38. You might want to come off sooner. You might just want to think about that. And really, ideal is prep your body for 2 years. 1 year it's awesome. 6 months is the minimum. And I just have to share, so this study came out this year, and I don't want to scare anybody. And if you did the pill and then you came off and you had a baby, like just let it go. And you can even fast forward through this part if you don't want to hear this. But I've always said, like, you need to give yourself at least 6 months. This is what I've seen clinically. Well, a study came out this year showing, so in 2018, as we're speaking, showing that women who are on the pill who get pregnant within 6 months of coming off of it, that their babies are at higher risk, their children are at higher risk of childhood cancer. So that's a big one. Like that's a big reason to consider like giving yourself time to get what I call baby body ready before you get pregnant. And they don't know why yet. Okay. So this study just came out and they're like, we don't know why. And then there's critics who are like, I can't believe you would even question the pill. This is women's rights. Yes, it is a woman's right as much as it's her right to have the full story. So at the end of the day, she feels she made the best decision for herself. Now, I know we got to get into like thyroid. We're going to talk a little bit more about that. But like if there is any medication or anything you're doing that impacts your thyroid, that can also lead to infertility and fertility struggles as well. Hormonal birth control is associated with triggering autoimmunity. Women with autoimmune diseases have a harder time getting pregnant. And there's been studies to show if you have elevated TPO antibodies, like me, well, those are in remission now, but those are the antibodies that lead to Hashimoto's, that you're going to have a harder time getting pregnant, but worse, if you do get pregnant, you're at much higher risk of having a miscarriage. And it's something that I think I've had a miscarriage, and I have to say, like, medical school did not prepare me for that. Medical school was like, and I mind you, I went to naturopathic medical school, which I think has like a leg up of like really holding space for women. But they were like, oh, it'll be like the worst period of your life and, uncomfortable and you'll move through it. And it was something where I was like, nobody prepared me for having like my heart ripped out of my chest like that. And it was something that it made me in a lot of ways. It took me a while to get there, but I'm grateful for it because it made me a better doctor. And when a woman has a miscarriage, when she's my patient, like the very first thing I say is, I want to acknowledge there are no words in this world that are going to comfort you in any way. Like there's just no words. There's no words that can comfort you when you go through that. And nobody can, unless somebody has had a miscarriage of a baby they really wanted and like were attached to, they can't relate. And I say that as somebody who thought like, my naive early doctor years of like, yeah, I'm there for you. I'm making fun of myself right now, but it was only once I went through miscarriage that I was like, oh my God, I had no. And it's just like having a baby too. You think you know things about like, oh, what it's like to be pregnant and what it's like for a mom and what it's like to have a baby. You don't know anything until you've been there. You're like, okay, no. But for me, having that miscarriage, it came down to what was going on with my thyroid.
Mm-hmm. And then as far as long-term use of the pill, like how long could we then have this post birth control pill syndrome? Is it 6 months? Is it a year? How long is being on it too long?
Yeah, nail on the head is 6 months right there. So it depends on what we're talking about. So it really depends on what we're talking about in terms of symptoms and things that can come up. But the majority of the research points to like 6 months is the minimum mark there in terms of if you've been on the pill for 6 months, these are the changes that start to happen. We start to see increase in sex hormone binding globulin, and we start to see some of these other issues come up. So in terms of long-term use, when I was speaking about the thinning of the endometrial lining, that happens, what the research was showing is about 10 years. So, we are in a very interesting time in terms of women's medicine in that, hormonal birth control is now, we're seeing women who've been on it for decades. Like it used to be like, hey, you take the pill between pregnancies so that you can manage when you want to have that next baby. Like that's when it was first introduced. Now it's something that is the magic wand for every female ill. It's the pill for every female problem, I say. And, with that, we're seeing women. I mean, I've had women in my practice who were put on hormonal birth control as a teenager. They're now in their late 40s. They've never even had a cycle that wasn't pill induced. And that's always fun. The very first time a woman in her 40s sees fertile cervical mucus, they without fail call my office freaking out. They're like, I think I have an infection. There's all this like goop, it's like snot in my underwear. What's happening? And I'm like, congratulations, you are ovulating. And like, they've never seen it. And that's something that, I remember the first time it happened and I was like, that's so weird. Like, how did she not know like what that was? And I was like, okay, you need to start doing better education around that. And then recognizing that, like I was discussing with women in their 30s, their 40s. I have women I had one woman in her early 60s that her doctor, she was still on the pill. I'm like, what are you doing on the pill? And she's like, well, my doctor said when your periods stop and you stop cycling, then you can stop hormonal birth control. And I was like, wait, hold up. Your doctor doesn't know that's a withdrawal bleed? Like you're having fake periods? And she had been on it for as long as she could remember. And she had never really had a cycle. When she came off, sure enough, she was in menopause. And she's like, I don't know how long I'm in menopause. The technical diagnosis is that you have to stop having a period for 12 months. But I'm like, you're in your 60s. Like biologically speaking, like we are not programmed to keep having babies into our 60s. So it's not likely that you've been, basically been able to have a natural menstrual cycle for years now.
Mm-hmm. And then as far as the different types of hormonal birth control pills that are options, Depo-Provera or IUD or the patch or NuvaRing, like which, or the shot, like what, do they all affect us the same? Or are there ones that potentially could be more harmful?
So, we've got a lot more research on the pill because it's been around the longest. And this is another area where I'm like, we need a lot more research because we thought for a long time that the synthetic estrogen in the pill was all the trouble, all the problems, all the side effects. And it has its side effects. But we're starting to understand with newer research, the progestins, which are synthetic progesterone, which, by the way, your natural progesterone or a bioidentical progesterone can help maintain a pregnancy. A progestin cannot do that. Your natural progesterone stimulates GABA in your brain, makes you feel chill, calm, love with your life. Progestin does not do that. Your natural progesterone helps with water retention. So if you don't have enough progesterone leading up to your period, that's when you're like, I can't get my ring off. My feet feel fat. What's going on with my shoes? I'm all puffy and bloated. Mm-hmm. Progestins are not a diuretic like that. They won't help with that. And so I give those examples for women to understand. Most doctors and researchers do not understand that progestin is not progesterone. And they might understand it at the surface level, but you'll still catch them saying, like every time this bad study comes out about progesterone and then you look at what they're using, sure enough, it's a progestin. And I'm like, that's not the same. All right, what a woman made in her ovaries is not the same as what you made in the lab. Like, stop pretending that you're as cool as a woman. You're just not. So, with that, we are understanding now that So there's a giant study that came out of over 1 million women showing an association with hormonal birth control and mood symptoms. And everybody was like, okay, the pill's causing problems because it's got that estrogen. But hold up, wait. Oh, but these progestin-only IUDs actually are really problematic as well. So, with the progestin-only IUDs, not every woman stops ovulating. So with the pill, you should stop ovulating. That's how it prevents pregnancy. With the IUDs, so like Mirena, Hyleena, Skyla, those are inserted. They actually shift the mucus. They affect the uterine lining. They're doing other things, but not every woman stops ovulating, although you can. And then you'll see people argue and be like, it's not designed to do that, therefore no woman stops ovulating. And I'm like, come on. Like some women do, some women don't. Again, can we just get some more research so we can understand who, why, what? Like why does it happen? With the Depo shot, I've seen women, and so as I was saying, hormonal birth control has been associated with triggering autoimmune conditions. I've seen women get the Depo shot. It can be a triggering event for them for autoimmunity. I've seen women get the Depo shot and then their periods just not come back. So they're like, yay, no periods. 6 months later, wait, this is not how it's supposed to work. And we have to do a lot of work around that. And so, we're at a place right now where medicine is shifting, because women are demanding better. And that's really, I want to be the catalyst and get behind women and be like, yes, you should demand better, to where we are starting to question these things a lot more. But it's been taboo. It's been taboo in medicine and society to question hormonal contraceptives because without a doubt, they've been instrumental in so many women's lives. They've been a tool so that she could pursue her goals, her dreams, and control her fertility. I mean, I took the pill for 10 years. I'm a first-generation college student. This was a tool that I leveraged to be able to get there. And so, a lot of people don't want to question it, or they feel like if you question it, it's anti-women. And I think what's really anti-women is telling them stories that you really have no evidence to back up, or dismissing their stories. And so, even as that comes out of my mouth, I've had people say, there's no study that's ever said post-birth control syndrome. And I'm like, right. And once upon a time, there was no study that ever said leaky gut. Now you go to PubMed and there's tons of studies on intestinal hyperpermeability, AKA leaky gut. Mm-hmm. There was no studies about adrenal fatigue, quote, which now we understand is HPA dysregulation, also flooded in PubMed. There is no study right now to say post-birth control syndrome. I made the term up, okay? I'm going to own that. But it's how we start. We start by getting a common term, a common language, so we can start to communicate about it. There are plenty of studies to back up all of the symptoms of post-birth control syndrome. There are tons of studies, but you know what's even stronger than all those studies? Get on Instagram, get on Facebook, get on a chat room, and you will see all of these women's stories. And so, what we know about medicine is by the time something is shown in medicine and research and it's shown to be true, it's going to be a good couple decades before doctors start adopting that. And that's on average about 17 years. So I don't know about you. I'm 37. I ain't got 20 years to wait, okay? I ain't got 20 years to wait for medicine to adopt it. And so that's why I go to the research, but it's also why I believe women's stories. I'm always curious about women's stories. When someone tells me like, oh, I had X, Y, and Z happen, I'm like, I've never heard that before. Can you tell me more about that? Because just because I've never heard it before, it doesn't mean it's not true. Just because I can't find it in PubMed doesn't mean it's not true. It just means that no one's been asking the questions surrounding this.
Yeah, it is to dig further, right? And to not just take things on surface level and really be your own advocate. And that's why I started this podcast, to educate women to know there's other ways to look at this instead of going straight off to the fertility clinic. If you've been on, in this case, if you've been on the pill, to dig deeper as to what's happening with your body.
Well, and I love that. And I love that you have this podcast, because the reality is that the majority of things that will move the needle of your health are not going to be what takes place in a doctor's office. It's going to be what you do every single day in your life. Like, you have that much power. I'm letting you in on the secret that maybe they don't want you to know, is that what you put at the end of your fork, the way you talk to yourself, the way you move your body, the chemicals that you are exposed to or not exposed to, like all of that has so much more power than most of the medications and supplements that we can pass you.
Absolutely. Absolutely. So how do we then balance our hormones after the pill and prepare for, we'll focus on our preconception health? What are some steps that we can take?
Yeah. So, with that, so first thing I should say is that we should define post-birth control syndrome. So post-birth control syndrome, those are the signs and symptoms that come up on average about 4 to 6 months after stopping hormonal birth control. And those can be things like gut symptoms, skin symptoms, or hormonal symptoms. And so with that, that's if a woman has really done nothing to prep her body. And so you'll love in that, in Beyond the Pill. Did we send you my book?
No, I don't have it. Yeah, no, I'd love to
I'm
read
going to
it.
send you that because there's an entire chapter in there about fertility and getting your libido back, because those two go hand in hand, and most women lose their libido with hormonal birth control. And if you're wondering, like, do I need to want to at least have sex to have a baby? Yes. Ding, ding, ding. You are spot on. So, and if you don't have a libido, that's a sign that hormones are not right. There's something going on with your hormones and your vitality. And I also want to say, sometimes it can be your partner. So we just want to acknowledge there are these mental, emotional components with that as well. So I don't like anything that just 100% points the finger at the woman and makes her feel like, oh, this is all me. I'm broken. You are not broken. You were never broken. You were not born broken. Okay. And whatever's going on, you can heal yourself. So in my book, Beyond the Pill, I outline the 5 steps, or what are the Brighten protocols. So this is what I have developed in my clinical practice. So there's an entire chapter that will talk you through this piece of what should you consider before coming off of hormonal birth control. If you had incredibly painful periods, if you have endometriosis, so I like to be really fair and honest with endometriosis, because leveraging the pill or any kind of hormonal birth control can really make it so a woman can live her life. And people will be like, oh, it's just a bad period. I'm like, no, these are women who can't leave their house. They can't function. And so sometimes we have to use hormonal birth control while we work on some of that root cause. That if you have endometriosis, it's probably going to take you a good 6 months or more of prepping, doing lab testing, getting in the know of what's happening with your body before you make that transition off, because your periods can be that painful. And I say this because I think that in the natural medicine, functional medicine arena, we like to be like, do it naturally. You can do this naturally and just come off. And it's so you mentioned you had thyroid issues. When I was hypothyroid, it's how do you heal yourself? You have to eat a really good diet. Oh, wait, it takes energy to eat that really good diet, but I'm super, super tired. You can't necessarily do all of that stuff. If you're in complete pain and just feeling like you're getting kicked down by your body. So, with that, could take a good 6 months or more to prep your body. Then you're going to transition off. And if you have endometriosis, it's going to take there's going to be some work to do for several years, depending on how long you've been on hormonal birth control. That doesn't mean it's going to take several years to feel better. You should start feeling better. It just means to really turn that whole ship around. It takes time. And so I say the same thing of for however long you are on hormonal birth control is how long you're going to have to stay in months. And I'm going to explain this when you come off of hormonal birth control. So for me, I did the pill for 10 years. When I came off, that's at least 10 months that I was going to have to really double down and focus on my body, and no messing around with that. So if you're a woman who got on the pill or any of these hormones, maybe you had acne, you have PCOS, you have some other kind of symptoms going on, prep your body for a good 3 months to avoid post-birth control syndrome. And you can do that. Beyond the Pill takes you all through that. I also have an online program, the Birth Control Hormone Reset, where women will go through that. They'll do all of that work for 3 months. They'll come off, they'll repeat the program. And that's why I'm you get access, you bought it, you get access to that, and you just keep it because you're going to need to keep doing these things. So with that, when you come off, so if you've already come off or you're thinking about coming off, you can go to drbrighten.com/PBCS diet. That's the dietary approach, just the first foundation that you can start doing. And that's going to be a big focus on loving up your liver and what I call the post-birth control detox. So whether you're on it or off of it, I want you to grab that guide. And even if you've been off of it for 10 years and you're having symptoms, we'll grab that guide. Start doing those things now. So Because what I've seen clinically is that if you've never done the work to undo the negative side effects of birth control, so like leaky gut, the metabolic mayhem, the microbiome disruption, that you're going to have to do that. Like you have to do it. It's not something that like your gut just spontaneously heals on its own, unless you are feeding it, you're honoring it, and you're really targeting what needs to happen in order to do that. So that's one of the 5 steps of the Brighten protocol. And I can just run through those. So number 1 is you need to replenish your nutrient stores. Wherever you're at in your journey, do it now. Please get yourself on a quality prenatal. And I often recommend, so like my prenatal plus, I formulated it in this way that I recommend that women have at least 200 micrograms of selenium. The reason is that hormonal birth control depletes selenium, but 200 micrograms is the sweet spot that's been shown in the research to lower TPO antibodies and to optimize thyroid function. And I was a woman who had a miscarriage that came down to what was going on with my thyroid, which is why I formulated that prenatal in that way, and that it has like methylated B vitamins in it and ample zinc and all of these things that hormonal birth control depletes. So replenish nutrient stores. It's got to be food. And then you're going to need to use a supplement. You can't out diet hormonal birth control. I wish you could. I'm totally food is medicine first, but you also can't out supplement if you have a poor diet. So they got to go hand in hand. Now, so step 2 of 5 is that you need to identify your hormone imbalance. So this is very individualized. With hormonal birth control, when you come off, it may be, so when you got on, it might be that you had estrogen dominance. You might have had a thyroid issue. It might be testosterone. When you come off, there might be something that's specific to you that's not going to be the same for another woman. And so in Beyond the Pill, I give this big quiz so you can figure out your hormone imbalance, whether it's, and there's an entire chapter on thyroid and adrenal health. There's an entire chapter on mood symptoms with that, because that's certainly linked to these nutrients, to inflammation, to what's going on with our hormones. But you'll also be able to understand, is it estrogen, progesterone, testosterone that's driving your hormone imbalance? You can figure out like, who's the lead player in messing with my mood, my metabolism, my thyroid, all of that. You can start to heal yourself straight away. And then I give a whole protocol around that. Now, 3 of 5 is you've got to heal your gut. This is non-negotiable. Like hormonal birth control has been compared, so the pill has been compared to antibiotics in some studies in terms of how it wipes out your good flora and can induce leaky gut, the hyperpermeability of the intestines, which that can lead to an autoimmune disease or food sensitivities. And we also get yeast infections like crazy when we're on the pill. And in fact, there's studies that show that it alters our oral and vaginal ecology. So gut, vagina, mouth, all disrupted. And so this is another reason to prep your body before you come off of birth control and get pregnant. Because if you have candida or yeast overgrowth in your vagina, then you birth a baby. So 1, it's going to get worse during pregnancy. And 2, you're going to birth a baby who's likely going to end up with thrush, which is no fun for anybody involved. But also that's going to be baby's microbiome. A baby's going to be predisposed to yeast overgrowth. Now, 4 or 5 is that post-birth control detox. Now, I like to be very specific. We are not detoxing out the hormones. Okay, your liver is doing that, but because your liver's doing that and working overtime, your liver's taking a hit. So while you're on hormonal birth control, and I have a whole chapter on liver in my book, which my editors were like, you have a chapter on liver and gut first. So you get into part 2 of my book and it's like liver health, gut health, and then we get into hormones. They're like, people are going to want hormones first. I'm like, oh, I know that. I go round and round with this all day, every day in my clinical practice. But if your liver's not right and your gut's not right, forget your hormones. They're never going to be right. So you have to do that non-sexy work. Everybody's like, can we just give me progesterone? Can I just fix my progesterone? And I'm like, well, if your gut is stressed, then your adrenals are stressed, then your ovaries like, girl, we ain't having a baby. Like, no way. So you've got to really love up your liver in a big way. It's part of, I have a whole set of recipes and a whole meal plan in there, plus a whole detox protocol and a quiz to know, like, do you need to get supplements on board as part of your detox protocol? And it's not important because with the introduction of the pill came the rise in liver tumors in women. So benign liver tumors, I will say that they don't tend to be cancerous. They can be, but it's more common that they are benign. But it also alters your genetic expression within the liver. So certain genes are expressing proteins differently. So there's a big need to support the liver. And then the five is metabolic repair. Because if you have insulin dysregulation, you are inflamed, if you have changes in your electrolytes, all of these things can cause a whole lot of symptoms, but it can set you up for chronic disease for life. There's a study that actually showed just 6 months on hormonal birth control. So back to when you were like, what's long-term use? Well, 6 months seems to be, for some of these symptoms, but 6 months on hormonal birth control, when a woman enters into menopause, she's about 35% increased risk of developing diabetes. So this is something I certainly think women should know. And we know that blood sugar dysregulation can be a cause of infertility. We know that if you have, an autoimmune condition, that can be a cause of infertility. And so this is why, if a woman wants to go the IVF route, that's thank goodness we have that option. I want to say that. And if you're listening to this and you're like, well, I have to use the pill because I'm doing IVF, and yes, you do. That's the way that works. And so if you're listening to this and you're like, oh my God, it does all these bad things, and am I going to be ruining my body? I have at drbrighten.com, I've got a ton of resources there, but beyond the pill, my book has got you covered in that. I don't specifically go into IVF that. I could write a whole book on IVF and fertility itself and all of these issues, but everything that's in there, if you can implement those protocols while you're having to use the pill to get ready for IVF, you're going to be way ahead of the mark. You will be able to keep those nutrient stores up. You will be able to love up your microbiome and make sure that it's in check. There are lots of things that you can do to take care of your body. So don't feel like I'm finger wagging at you or shaming you and all that, or that you're just going to be ruining your body. What do all of us do as moms? The very first thing we do, we get in the mirror, we look right at ourselves and we say, this is all your fault. This, and I, as I shared with you, my kid just recently became extremely ill, extreme onset of neurological symptoms, regression, and I totally went there. And I knew as I went there and was like, this is all your fault. This is because you have Hashimoto's. This is because of this. And and it's just what good is that doing? And even when I was doing it, and I was like, I know this is not helping anyone, but I kind of had to just let the thoughts play out. And just be let it move through you. Let it move through you, because if you suppress it, it's just going to come back to bite you again. But I think it's something why I wanted to say all that is because it's really easy for ourselves, us as women, and especially as moms. There's something once you become a mom, everything is definitely your fault in your mind. And, with that, it's really easy for us to play the blame game. And then without a doubt, medicine comes to back you up and to be yeah, it's because when studies come out and it's forever. Oh my gosh. I remember I've been in this arena for 2 decades now. And I remember when the autism blame game started, where it was it's because of mom this and mom that and mom. And it's this is important for us to have this information. But then some people were running with it of it's because you did this. And it's you know what? Had she had that information, had she known, she would have done better. So stop that. That doesn't serve anybody. And then the research started to come out about men, and it's oh, you think 50% of the equation might be contributing here? But in reality, I think that society as a whole needs to step up and take some responsibility with all of these things, because it's so easy for people to be it's because mom, was taking folate, too much folate. It was because mom wasn't taking enough folate. It's because mom this and that. And it's hold up. Are we all drinking out of plastic water bottles? Are we all are we all contributing to our environmental toxicity? We are. Society, wake up. Everything that's happening to our children now, we all share responsibility in that. And can we just take a minute to praise our mothers? Because not only do they create and birth life, but they are the caretakers of the future of the human race. And they're giving up so much to make sure that our species survives. So that's a different soapbox, but I'm on it. And I just want to say, there's not enough respect given in women's medicine, and there's certainly not enough respect given to mothers and how much they give up and how much they try and what they're really doing. And in medicine, we dismiss women left and right. And I think there is something too about being a mom, or that it's really quick to be dismissed. I shared with you, doc's telling me, you just need to eat right and exercise and sleep more. Don't ever tell a new mom she needs to sleep more. You think she doesn't know that? She knows that. She will be doing that. Well, that baby's up all night, and somebody has to feed that baby because their liver isn't developed yet. And hello, we don't birth in tribes anymore. So like, it's not like we have like a plethora of women around us who are ready to step up and help us out. It can be a very lonely journey the way modern society has set it up.
Mm-hmm. I just kind of want to circle back to the diet piece on this. So because we recommend elimination diet, what's your kind of go-to there for the supplement and diet protocol?
Yeah, I love that. Okay, so what I want to say about the elimination diet is that I think it's a really important tool because there's a lot of really good health information out there, but you have to know what's true for you. What's true for me is not true for you. And so that's where the elimination diet comes in. You can be your own detective. So in Beyond the Pill, there's a 30-day diet protocol, and we do an elimination. I do not eliminate eggs in that protocol. Okay. And the reason for that is because there are a lot of vegan and vegetarian, well, not vegan, but vegetarian vegetarian women who will still consume eggs. I haven't seen eggs being as big of an issue in terms of post-birth control syndrome. Now, autoimmunity, other conditions definitely could be. You know, I've done the AIP diet, the autoimmune diet. I do a reset once a year with that, and then I do take out eggs. Big reason why I left eggs in, clinically I found if you don't have high quality protein, and ample amounts of it, your liver's not going to detox correctly. We all need amino acids to run those detox pathways. But when you have been using hormonal birth control, you definitely need that. And it's already stressful enough for a lot of women to come off of hormonal birth control. And I have them eliminate coffee as part of that. Nobody loves me for that. But the other thing is that pastured eggs, so chickens that actually get outside and they eat those bugs and they're out there being little carnivores like they are, the eggs are really nutrient dense, and that egg yolk is actually really beneficial in terms of building our hormones. So we need that cholesterol, we need the antioxidants are in there, but also the biotin and other nutrients that are in eggs that can help us with the hair loss. It can help us with our fertility. And so that's the reason why eggs are left in there. And we tested this out over the years, and we were like, with my autoimmune patients, I've seen eggs be an issue. With my post-birth control syndrome patients, I actually find that allowing them to have eggs, things get better a lot quicker, and it's a bit less stressful, and especially when we're talking about vegetarians as well. But I absolutely think women should do an elimination diet. Dairy and gluten are often the hardest to bring back in. We definitely eliminate gluten. We know that so you should get tested for celiac disease before you remove gluten, but that can be a cause of infertility. So, and just so you know, celiac disease in an adult presents differently than in a child. Children, they don't grow, they have malabsorption issues. In adults, we often see neurological issues like onset of migraines. How many women have migraines? And so any patient of mine who has a migraine, I'm like, yeah, we need to test celiac. We need to make sure that you don't have celiac disease, because that's something that you can't get gluten. It's non-negotiable with that. Now, the other thing about the Brighten protocol diet that I've put together is it's super nutrient dense. It's very focused on making sure we're getting cruciferous vegetables in as often as possible. And we also incorporate seed cycling with that. And I will say with seed cycling, so seed cycling is like old school naturopathic medicine. That's when I was first introduced to it. I've been seed cycling for a decade now, which is kind of staggering. I'm like, whoa, you've been doing this for a long time. But with that, with seed cycling, I learned about this in naturopathic medical school. It's one of the go-to first places you start with diet. Unless someone has, they're doing the autoimmune paleo protocol, that we can't have the seeds in there. We have to bring those in and test them later. But with that, I was like, okay, this is good stuff. This is good stuff. It was actually when I was in my first year of clinical practice, I had a woman come to me with PCOS. She was exercising. She was eating a paleo style diet. So that means high quality fats, high quality proteins, tons of vegetables, and very low in inflammatory grains, if not any. So she's already doing a lot of these things. She's not on any supplements. I'm like, okay, let's get your baseline testing. But something you can do right now is you can get seed cycling. And all she wanted was to have a baby, hold a baby in her arms, primary goal. And then 6 weeks go by. I have her lab test. I'm like, why haven't I heard from you? What's going on? And she was like, oh, I actually had to go meet with my OB. I'm pregnant. And I'm like, wait, what? And she's like, yeah, I did a month of seed cycling and I got pregnant, and I didn't even get my period back. And lo and behold, I got pregnant. She made me a believer in seed cycling. Like, that was a moment where I was like, hold up, seed cycling did what? Because I was like, oh yeah, it's good. It's helpful. It's an adjunct therapy that we do with all these other things. And that was the only thing that she had changed, and she got pregnant. And then I had told her, like, you know, should you get pregnant, get to your OB right away, because you might need progesterone. We want to make sure we maintain that pregnancy. And so that's what she had done. And I was like, well, girl, you got to call me and tell me you got pregnant with that. So seed cycling is definitely something I recommend for women who are not familiar with it. I want to say the worst thing that we can do in our health is get dogmatic about things. And I see people get really, really like dogmatic about we have a saying in my clinic, and it's dogma equals death. Like, the fastest way to get to your grave is to get really like dogmatic about everything you do. Like, life is more fluid, like roll with it. Like, what is the organism that survives? The adaptable organism. So with seed cycling, you're going to do flax seeds, and they have to be fresh ground, because you don't want them oxidized, and you're not the kind of animal that can digest them that well. So you got to grind them. Flax seeds and pumpkin seeds, the first half of the cycle, days 1 through 14. Now, you can do a tablespoon of each. You can do 2 tablespoons of each. I usually recommend women aim for like 2 tablespoons of each if we've got major issues going on, symptoms, things like that. If you can only do 1, that's fine. You know, I'll see sometimes people out there posting about this, and they're like, you have to do 1 tablespoon of each or it will not work. And it's like, well, I've been doing this for 10 years, and I've had a lot of patients go through this who are like, I only did the flax seeds, I only did the sesame seeds, and like, it still works. Okay. So we've got our ideal, and then we've got reality of like, okay, sometimes you're just gonna have flax seeds on hand, you're gonna roll with it. Sometimes you're like, I don't even want to look at flax seeds, I'm gonna eat the pumpkin seeds. Like, it's okay. So first half of the cycle, what if you're not cycling? You're going to go new moon to full moon. And if you're like, what's she talking about moons for? You got to grab Beyond the Pill, because we don't even have time for that conversation. But I talk a lot about the moon cycle and how it relates to your menstrual cycle in Beyond the Pill. And you can actually work with the moon cycle if you're not ovulating and not having periods to restore your menstruation. And, you know, I have helped so many women get their period back. I've had women 4 years of no period and their reproductive endocrinologist is like, the only way you're going to have a baby is with IVF. We had a woman who went through my birth control hormone reset program, and I couldn't even believe it. Like, these women I work with, they teach me so much. So I had this one woman in particular, which, you know, her video is online. It's on my YouTube channel, Katie, where she went to a reproductive endocrinologist. They were like, you came out the pill, you had a period of 4 years, you're going to have IVF in order to get pregnant. 5 weeks of doing everything that I'd say probably doing 80 to 90% of what I outlined in that online program. And she got her period back. And her doctors are like, wait, what? How did you do that? And this is the cool thing. I love doctors. Like, there are a lot of great medical doctors out there and specialists who, you know, they listen to their patients. They're genuine scientists who are curious. And they're like, wait, what? How did you do that? How are you able to do that? I have so many women who write me, and they're like, I did your protocols. We've had patients, I've had women write me, they haven't had a period in 7 years, 10 years. And they're like, I got it back in a matter of 3 months, in a matter of 6 months. I got my period back. Something that my doctor said I would never be able to do. And it's the diet for sure. Seed cycling. So I went on a little tangent there. So we've got flaxseed, pumpkin seeds happen in the first half of the cycle. Around day 14, you go ahead and flip them. You go to sesame and sunflower seeds. All these seeds need to be raw. They can't be roasted because you got to get in on those good fats. I actually hate sesame seeds, fresh ground. So I just own that. I own it. I will still eat them. But a lot of times I'm doing sunflower seeds, and that's how I roll. It still helps me. I still have a lot of patients that it's helped as well. And if you are not menstruating, then what you're going to do is that when that full moon hits, think full with full belly, pregnant, all right, full moon's out, waking you up. What you want to do? You want to have sex. So that's why a lot of women will ovulate with the full moon. By the way, you can ovulate either way, new moon or full moon, and still have a pregnancy. I was a new moon ovulator. I got pregnant. So I just want women, that's like top question I always get. So you'll flip it at the full moon. That's when you go into the sesame, sunflower seeds, 1 tablespoon of each or 2 tablespoons of each, or do 2 tablespoons of one, like whatever you can get in and will work for you. Like, it's going to be better than doing nothing. So And then part of, getting your period back, clearing your skin, getting your libido back, maintaining your mood, reversing that metabolic mayhem is definitely smart supplements. So we do the diet piece. That's a must. We've got to have the lifestyle factors, moving your body, making sure you're honoring your circadian rhythm. I mean, I go into so much detail in my book on this, but then you've also got to be leveraging supplements. And so in Beyond the Pill, I have a whole quiz for you in there so that you can understand which supplements are best for you. If you're coming off of hormonal birth control, then the biggest needle mover that I've seen is to put women through a 14-day detox. And I've developed 2 supplements. One is the Paleo Detox. That's my favorite. Like, why it's my favorite is I like the way it tastes a lot, but it's bone broth based protein, which is going to help heal your gut as well, and very blood sugar maintaining. But I respect that you may be a vegan for religious reasons. And if you've been listening this whole time, Dr. Brighten doesn't like to tell you how to live your life because I don't know how to live it better than you. And so I do have a plant-based detox, which is a pea protein, an organic pea protein. And they come in kits, and we do that for 14 days. My husband and I are actually getting ready to hit that and go through that again. We've actually been under quite a bit of stress with our son recently. And when you're under stress, that can actually, and you're not sleeping. By the way, if you don't sleep, forget liver detox. There's studies that show that your liver will not detoxify and function optimally if you're not sleeping. My kid's been sick. I haven't been sleeping. I've been trying. I'm like, okay, I need to load up this liver like nobody's business. And these kits are actually loaded with antioxidants. Antioxidants get depleted by hormonal birth control. They protect your ovaries and your mitochondria. And what's up with your mitochondria? That DNA becomes baby's DNA. So we gotta get that mitochondria right. It's concentrated in female women's ovaries. Men don't have ovaries, but also in the female brain. And so that's why we can start to have ovarian dysfunction, and we're also getting neurological symptoms like brain fog, starting to forget things, feeling like we're not on our game. And that can be a sign that it's your mitochondria. And so that's what we'll kick women off with is let's hit it for 14 days. We're going to do that. We're going to get the diet in piece, work on the lifestyle piece. The nice thing about doing those supplements is that, and these are there's capsules, but there's also this powder. The nice thing about doing that is that anytime you adopt a new diet and lifestyle practices, there's going to be hiccups, but this is got you covered for those first 14 days of figuring that out and navigating that. And I've actually seen it help a lot of women get clear skin, avoid that post-pill acne, which is what a lot of women fear. And then we utilize probiotics for sure. I'm a big fan of starting with spore-based probiotics. If you don't know what's going on, there's a lot of women who have small intestinal bacterial overgrowth, yeast overgrowth, parasites. They can have a lot of gut dysfunction because the pill left them susceptible to those things. And so with that, a spore-based probiotic, that one is not going to aggravate any of those conditions. In fact, it's going to increase microbial diversity, and there's good science behind that. And then we get, so I have a product called Balance. It's a women's hormone supportive supplement that helps balance out estrogen, progesterone, and testosterone. It does that because it has antioxidants in it, but it also has things like calcium D-glucarate, which helps. So your liver is going to package up your estrogen. It's going to need things like DIM to do that. Broccoli seed extract is also in that supplement because broccoli sprouts, broccoli seeds are always winning. So it's going to help with the liver detox component, but the calcium D-glucarate makes sure that what you packaged up to move out actually gets out through the bowels, because not a lot of people know that your liver can do all that work. Then you get to your gut, and your gut reactivates your estrogen, and it all goes back into circulation again. It has green tea extract. That's going to help. That's going to help with so many things, but it also helps with testosterone as well. And so testosterone can come back big time after hormonal birth control, and the wrong kind, causing acne and hair loss and hair growth on your chin. Nobody likes any of that. So that's a few of the things we use. And then I'm a big fan of using a prenatal. If you are a menstruating female, you are losing iron through that menstrual cycle. So I like using a prenatal, and I just find that women, they feel a lot better with a prenatal. You can also choose a really quality multivitamin, but if you think about it, prenatals are designed to help you grow an entire human. And so they're locked and loaded with nutrients. And then, they have that benefit of everybody's hair, skin, and nails gets a whole lot better. So that's few of the supplements that I recommend. Within Beyond the Pill, like I have a whole gut protocol of gut healing supplements. I go through in detail in terms of like, okay, here's the other things you want to consider if you have excess testosterone. Here's what you should consider with thyroid. And I will say in most, if not all women, we also use my adrenal support product because hormonal birth control, as I said, is inflammatory. It does mess with your adrenal glands. And the adrenal glands are really at the foundation of your hormonal health. If they're not healthy, then your sex hormones, you can't bring those back into balance. And so adrenal support is formulated so that when you get up in the morning, you spike that cortisol. It helps you keep it around longer, but it also has adaptogenic herbs that help with that stress response, which we know can impact our hormones. And then it's got a bit of licorice in it, not so much that it will aggravate people, but a bit of licorice because that also helps with testosterone. So testosterone doesn't just come from our ovaries, it comes from our adrenal glands as well. And so it helps balance out that testosterone. So we can have a libido, but we also don't have to have that cystic acne.
Yeah, which so many people do, the migraines, the cystic acne, all those different conditions you talked about there. So, and then as far as the gut, digging further with food sensitivities, with yeast overgrowth, parasites, SIBO, all those other kind of gut infections, which the pill can predispose us to. So that's a whole other kind of investigating further on that side of things with gut health. Yeah. Okay. And then as far as, so then you have got a free opt-in here, a free gift here for the audience. So the post-birth control syndrome diet. And that is, I think, is basically what you were talking about there. What do they get with that?
Yeah, so that's going to outline straight away, it's going to outline all of the foods that you want to avoid and all the foods that you want to be eating in order to recover your health and to optimize liver detoxification. So we talk a lot about that because if you can take care of your liver, like a lot of things are going to start to fall into place as well. There's a sample day meal plan in there so that you can understand how to fit that into your life. And in addition to that, there's also some mindset practices in there as well that you'll get. And then, for anybody, listening right now who's like, wait, is this right? If I'm on the pill or I've already come off of it, I designed it. If you're on the pill, off the pill, or any hormonal birth control, or you've ever been on it, this can help support you. And so it'll get you really dialed in on the best dietary practices so that you can start feeling better straight away.
I love it. So they can go to drbrighten.com/PBCS diet. And also have a link in the show notes. And thank you so much for coming on today. I just love your passion, your enthusiasm for this topic and being able to, share your words of wisdom with our listeners. And so thank you very much.
Yeah, thank you so much for having me. I really enjoyed this conversation. And, I really want to say I'm so grateful for the work that you are doing because we need more women advocating for women's health. Yes, we need men too, but I think that it is so important what you're doing. And it's so much part of my mission as well. Is like, can we put the medicine in women's hands so that they can take charge, they can take the reins and drive that chariot like the goddess they are and take back their health.
So we're getting super booked with our functional testing and couples coaching program and have very limited spots available. So there's only 4 spots available for January and February. So if you are looking to have your baby in 2019, please click on the link in the show notes to book your free call. So I'll let you know how the call works. So first of all, we support couples worldwide who are struggling with infertility to conceive and have healthy babies. So women like Rita, who gave birth to her beautiful daughter after following my fertility coaching system, or Danielle, who after 2 failed IUIs was able to get pregnant after a free call with me. So here's how to get my help for free. So I offer a free Supercharge Your Fertility Discovery Call. And on that call, I'll create a plan with you that is going to help you fast track your success. So this call is not for everyone. And I'm really picky about who I speak with. And I have a strict but totally reasonable criteria that needs to be met in order for us to move forward. So here's who I can help. You need to be able to explore your infertility diagnosis in a new light. This offers for people who are open-minded and coachable. If you can do that, and you want to double or triple your chances at the fertility clinic or get pregnant naturally, awesome. So let's get on the phone and chat. You must be an action taker, so someone who is committed to seeing results and you're able to follow directions. Don't worry, I'm not going to ask you to do anything bizarre. And if you're one of those people and you like to consume a ton of information, but you don't like to spend time implementing and seeing results, then this isn't for you. I only want to spend time with people who are genuinely committed to their own success. So just click on the link in the show notes and apply, or go to fabfertile.com and click on the free consult. It's a really short application that just tells you about your health, how long you've been trying to conceive, how soon you'd like to be pregnant. So this seriously will be the best time you've ever spent on your fertility. Looking forward to chatting.
Thank you for listening to Get Pregnant Naturally. Seriously, it means the world to me that you're here. Make sure you hit the subscribe button so you can be notified of upcoming episodes. I'm excited to offer you a special gift. If you're a U.S. resident, text FERTILE to 345-345. You'll be prompted to enter your email address and you'll receive our fertility yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to your heart. These simple fertility yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. So for U.S. residents, text FERTILE, FERTILE, to 345-345. For non-U.S. residents, go to www.yogafreebie.com to access your special gift. That's www.yogafreebie.com to access the free fertility yoga download. And I love this quote by Dr. Mark Hyman, Medical Director of the Cleveland Clinic Center for Functional Medicine and Chairman of the Institute for Functional Medicine. Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't in fact treat disease. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. Thanks for listening. Until next time.